Thank you. That's a very good question. Healthcare transformation and role of HIT. Healthcare as an industry, not only in the United States, but also globally, is going through some significant changes. In the US and Canada and in several other Western countries, this change is driven by the need to deliver high quality and affordable care. In other countries, such as in India and China and Brazil, citizens are asking for their governments to provide better services. And these governments are looking for pragmatic and sustainable healthcare delivery models. Health information technology is an enabler of this need. The proliferation of mobile technology, cheap computing and storage technologies, and general population adoption of new mobile technologies have made this need transformation possible. The challenge is now to build the infrastructure and applications and systems to meet this need, not just for Western population, but also for the global population as a whole. To help ensure that health IT projects deliver the necessary capabilities that address the needs of all the stakeholders, we have developed this education and training program that is targeted at the middle to senior management who have the accountability to improve care delivery in hospitals, clinics, and at the policy and standards level. What is new in this course? Often IT investment decisions are made based on what systems are needed. These decisions are often based on some implicit analysis of needs. Here, the IT solution itself becomes the goal, not the enabler. During this implicit analysis, many fundamental questions don't get addressed adequately. And if projects get kicked off, the project teams then continuously struggle with the trade-offs. Through this course, we make this analysis phase explicit and rigorous by looking at what are the outcomes are required, what will be required capabilities, what is currently working and good enough, what new capabilities are needed, etc. Once the need is defined in terms of measurable performance of enterprise capabilities, then we take a systems thinking approach to truly understand the problem from all stakeholders' point of view, and only then solve each segment while keeping the entire problem in mind. This approach engages the right level of decision makers at the right time, and decision process becomes transparent and accountable. This is a hands-on learning course with the pre-work and post-class work. QRS Instructor is available to the students before and after the class as students complete the transformation strategy for their organization. Yeah, this is interesting. To teach a course into healthcare workers, often you're required to be an MD. But I'm not an MD. But we have taken steps to ensure program quality. First, I worked as a business transformation practitioner in a number of industries for the last 25 years. During these years, I had many successes and some disastrous failures. Each has been a learning opportunity. Now I've been involved in the healthcare industry for the past 3 years, and I truly appreciate the complexities involved in healthcare systems. In other industries, where information systems that support the administrative process, impact of system failure is insignificant. As when information system in healthcare fails, people's lives are affected. Second, we have built a great advisory team which includes members of clinical, academic, and researchers in healthcare. The program is vetted by our advisory group. Third, the focus of this course is not on clinical matters, but creating a culture that fosters continuous improvement, transparency, and accountability, at more at management layer, less at clinical layer. How to evaluate success of an education program? Well, success of an education and training program can only be measured incrementally. Did the students acquire the business transformation skills? Did they use the skills to develop an effective business transformation strategy? Did the strategy and transition roadmap that they developed get a broad support in the organization to enable effective implementation? Did the transition capabilities help achieve the expected outcomes? If all four things happen, only then we can say the program was successful. It all depends on the relationship among the students, instructor, and the organization. My last word would be, thank you for visiting us. We look forward to work with you. For any questions or comments, reach us at clinicalmessage.org. Bye-bye.